I was wondering if you'd like to address our next question in terms of etiology of stroke.
Yes. So I think it is very interesting topic because we do think Chinese strokes have different stroke etiology with Western countries. For example, Chinese patients less likely have cardiac stroke. So in my experience and in my data, we only have 10 to 15% of stroke patients who have cardiac stroke. And nearly half of the stroke patients have large artery atherosclerotic stenosis. So actually, anti-atherosclerotic treatments are very important for secondary prevention of stroke in China. But I think you have a lot of patients with cardiac stroke, about 20 to 25% of your patients' population.
I suspect it's actually a little higher. I remember how, in the past when we were talking about cardioembolic stroke, and in the setting of cardioembolic stroke, 80% of them are due to atrial fibrillation.
Mm-hmm.
And now with the construct of ischemic stroke of unknown origin or unknown source rather, this number of patients with cardioembolic or stroke secondary to atrial fibrillation has definitely grown. And we're seeing it more in, again, developed economies. Places like Australia, I think the number of patients who have cardioembolic stroke is actually quite high.
Mm-hmm.
But we also have a fairly large number of patients with atherosclerotic disease, aortic arch, carotid arteries. The number of patients with intracranial atherosclerosis perhaps is lower than what you'd see in China.
Yeah.
Now, before I started work in Australia, I was actually working in Malaysia, which is where I'm from.
Mm-hmm.
And in our Malaysian population, what we used to see was that there was actually a very significant number of patients with intracranial disease.
Mm-hmm.
And in Malaysia, we have, I think, probably 27 to 30% of our population is ethnic Chinese,
Mm-hmm. Yeah.
but mostly Southern Chinese. And we found that they were the ones who actually had more pronounced intracranial atherosclerotic disease. So I wonder whether there are, sort of like genetic things as well that we might have to consider regarding the mechanism of stroke with regards to atherosclerosis, intracranial, extracranial, and working it out from there.
And how about the average age of stroke patients in your country? So in China, our stroke patients, the average of age of our stroke patients is about 60 years old. And how about in your country?
Probably about 10 years older than that.
Okay.
It's closer to the 70 range, 70 to 75.
So it might account for the different prevalence of cardiac stroke. So I think for older population, they may more likely have atrial fibrillation and cardiac stroke, I think.
I'd absolutely agree, because I remember from previous publications regarding atrial fibrillation and whatnot, and the importance of age as a risk factor. So I'd absolutely agree with that.
I guess the prevalence of intracranial atherosclerosis is about 10 to 15 in your stroke population, or lower than 10%.
I think probably lower than 10%.
Okay.
And Again, I'd probably consider it in terms of what the age group is of the patient that's involved. In my practice, if I have a younger patient, meaning under the age of 50, who has evidence of intracranial atherosclerosis, I generally go looking for another cause. So I start looking for things like vasculitis or autoimmune disease or something along those lines. Because as you said, it's really not very common.
Yes, I see. So I will have some comments. You think the patients below 50 is young patients, are young patients.
Yes.
For us, the young patients should be defined as the patients with the age below than 50, than 45, because a lot of patients, stroke patients in China, are around 50. They are not young.
Okay. Yep. Yeah, we generally tend to use the 50 cutoff for young stroke. And I guess this goes again to what I was saying earlier in terms of there are many things that we have in common. There are also many things that we might have or that we might do differently.
Yeah.
And all of it is a reflection of what you see in your own practice.
So we will check the autoimmune diseases in patients younger than 35.
I see.
Years old. So for the patients who is older than 35 years old, so we found that we are more likely have the traditional stroke etiology. That's our findings.
And the other thing that, of course, we pay attention to is that's when I get, I start digging for, other symptoms, systemic symptoms, unexplained fevers and rashes, joint pain. In women, very important to have an obstetric history as well. Early pregnancy loss, repeated pregnancy loss. All of those things will also factor in which patients I choose to investigate in more detail, looking for a secondary cause of stroke. But I guess the main difference would be in terms of what we perceive to be etiology of stroke in the different populations.
Yeah.
And I think that, to summarize, I feel that it is still true to say that in the Asian populations, the degree of atherosclerotic disease, whether that's intracranial, extracranial, is perhaps a little more important than things like atrial fibrillation. But I suspect that as the years go on, probably driven by two things. One, the aging of the population in Asia. And secondly, the fact that I think across the world, we're looking for atrial fibrillation more and more. And the more we look for it, the more we're going to find it.
Yes, I agree with you.